He pressed the barrel of his gun against the head of a 72-year-old man still in his hospital gown and screamed at the top of his lungs that the next person who moved would watch the old man's brains paint the floor. The ER froze. Nurses, doctors, patients, all of them stopped breathing at the same time. He wasn't asking. He wasn't negotiating. He was telling. And every single person in that room believed him. What none of them knew was that the woman standing 3 feet away in blue scrubs with a stethoscope around her neck and a paper cup of cold coffee in her hand had been trained to end men exactly like him. If you are watching this right now, subscribe to the channel, follow this story all the way to the end, and drop a comment telling me what city you are watching from. I want to see how far this story travels. Amara Mensah had been awake since 4:30 in the morning. Not because her alarm went off early, not because she had somewhere urgent to be. She had been awake because sleep for her was never really sleep. It was more like a conversation between her body and her past, and most mornings her past won. She lay in the dark of her apartment for a while, staring at the ceiling, listening to the radiator knock against the wall, and then she got up, made coffee strong enough to strip paint, and stood at the kitchen window watching the city come alive in the gray hours before sunrise. Veterans Memorial Hospital was 40 minutes from her apartment by bus. She took the bus every day. She did not own a car. She told people it was for the environment. The truth was that driving required a kind of distracted comfort she had not fully rebuilt in herself yet. On the bus, she could sit near the back, watch the doors, watch the other passengers, and let her mind work through the day ahead without the responsibility of her hands on a wheel. She was 34 years old. She looked younger than that to most people. Medium height, lean in the way that people who have spent years moving quickly are lean, with close-cropped natural hair and eyes that were darker than they first appeared. People sometimes said she had kind eyes. She accepted the compliment without correcting them. Her eyes were not kind. They were patient. There was a difference. She had been at Veterans Memorial for 11 months. Before that, she had spent 2 years at a community clinic in Baltimore. Before that, she had spent 8 years doing something else entirely. Something she listed on her resume as federal contractor, various assignments, because that was the version of the truth that fit inside a job application box. The actual version of the truth had a classification level that most people in that hospital would never hold the clearance to read. She was a nurse now. That was real. She had gone back to school, earned her RN, passed her boards with a score that surprised her clinical supervisor. Nursing was not a disguise. It was not a cover story. It was a choice she had made deliberately and carefully, the same way she made most choices, after measuring the variables, after understanding what she was walking toward and what she was walking away from. She was good at it, genuinely good, not just competent. She had a feel for patients that went beyond the clinical, a way of reading a room and reading a person that her colleagues sometimes found unsettling without being able to explain why. The ER at Veterans Memorial was not a quiet place on any given Tuesday morning, but it was the kind of organized chaos that Amara had come to find almost calming. There was a rhythm to it. Triage at the door, assessment, stabilization, handoff. She knew her role inside that rhythm, and she played it without complaint, without drama, without the need for anyone to notice her doing it well. What she had not accounted for on this particular Tuesday was Marcus Webb. She did not know his name yet. She would not learn it for several hours. When he walked through the ER doors at 7:48 in the morning, she noticed him the way she noticed everything, not with alarm, not with recognition, but with the quiet automatic cataloging that had been drilled into her over years of training until it was as involuntary as breathing. White male, late 40s, heavy build, running to fat but not soft underneath it, the kind of man who had been physically powerful once and still carried himself as if he believed it. He was wearing a gray jacket that was too heavy for the weather. He was not alone. There were 4 of them that she counted in the first 3 seconds after they entered. One more position near the ambulance bay doors, which she clocked because the movement at the periphery of her vision was wrong, too deliberate, too stationary for a person who belonged there. So 5 total, possibly 6 if there was someone outside she could not see yet. Webb moved to the center of the waiting room, and then he did the thing that stopped everything. He reached under his jacket, pulled out a weapon, raised it to the head of Martin Chu, a 72-year-old retired postal worker who had been sitting in a chair near the water fountain, waiting for results on a chest x-ray, and he said in a voice that was almost conversational, "Nobody moves, nobody talks. Nobody does anything I did not personally tell them to do. The next person who looks at their phone is going to make a very big mess. The waiting room did not scream. That was the thing that Amara noted first. The waiting room went silent in a way that was actually louder than screaming, a sudden, total absence of sound that felt like pressure dropping before a storm. Sandra Hobbs, the charge nurse on duty, was standing behind the triage desk. Amara watched Sandra's hand move instinctively toward the phone on the desk and then stop. Hover, pull back. Smart. Amara had always thought Sandra was smarter than she got credit for being. Phones down, Webb said, still in that same even tone. Everybody in this room puts their phone on the floor, slide it toward the center, now. Amara had her phone in her left scrub pocket. She did not reach for it. She shifted her weight to her right foot and turned her body 3 degrees to the left, which gave her a slightly better angle on the room without changing the overall picture she presented to anyone watching her. She was still holding her paper cup of coffee. She did not put it down. One of Webb's men, younger, maybe 25, with the tight jaw of someone running on adrenaline and bad decisions, moved along the row of chairs toward the patients. He had a short-barreled rifle held low across his body, and he moved with the kind of nervous energy that Amara recognized immediately as the most dangerous thing in the room. Not the man in charge. The man who was afraid and trying not to show it. She set down her coffee cup on the edge of the nurse's station counter. "Hey," the young one pointed at her. "You scrubs, get over there with the others." Amara looked at him. Not challenging, not afraid. "The way you look at something you are assessing." "I'm a nurse," she said. "I have patients on monitors behind that curtain. If I step away from them and something happens, you have a bigger problem than you already have." The young one's jaw tightened. He looked toward Webb. Webb had turned slightly, keeping Martin Chu close, and he studied Amara for a moment with the kind of flat appraisal that people who had done violence professionally brought to a room. "What's your name?" Webb said. "Amara." "Amara." He said it like he was filing it. "You said you have patients. How many?" "3. 1 on a cardiac monitor, 1 post-procedure, 1 who came in by ambulance 40 minutes ago with a head injury. And if you leave them, the cardiac patient is 78 years old with a history of arrhythmia. If his monitor alarms and nobody responds, he goes into a rhythm we can't pull him out of. Then you have a dead body in your situation, and dead bodies complicate things." She watched Webb think about this. She had given him the version of the truth that made it useful for him to let her stay near the curtained area. That was the only version she offered. "Fine," Webb said. "You stay where I can see you. You do not touch anything I haven't cleared. You make one move I don't understand, and your patients will need a nurse a lot more than they already do." "Understood," Amara said. She moved back toward the curtained bay. Her heart rate was elevated. She was aware of it the way a pilot is aware of the altimeter, as information, not as emotion. 62% of high-stress scenarios that ended badly did so in the first 8 minutes because someone panicked and changed the geometry of the room. The geometry of this room was already set. Her job right now was not to change it. Her job was to understand it. Behind the first curtain, Raymond Okafor, 78 years old, retired schoolteacher from Lagos by way of Atlanta, was watching the television mounted in the corner of his bay with the sound off. He hadn't heard what was happening in the waiting room. His hearing aids were in a cup on the bedside tray. Amara moved close to him, checked his monitor, adjusted nothing, and leaned down. "Mr. Okafor," she said quietly, "I need you to listen to me carefully, and I need you to stay very calm. Nod if you understand." Raymond looked at her. He had kind eyes, genuinely kind. He nodded. "There are some men in the waiting room right now who shouldn't be here. I'm going to make sure you're safe. I need you to stay in this bed and not make any noise no matter what you hear. Can you do that for me?" Raymond Okafor was a man who had lived through a military coup at age 19 in a country that was not his own. He looked at Amara Mensah with a clarity that most people 30 years younger could not have managed, and he said very quietly, "Do what you need to do, child." She squeezed his hand once and moved to the next bay. Daniel Park, 41 years old, was post-procedure from a bronchoscopy. He was groggy but awake, and he had heard enough. His eyes were washed and his breathing was shallow and fast. "Daniel," Amara said, keeping her voice at the pitch and cadence she had been taught to use in situations where a person's nervous system was deciding between fight, flight, and collapse. "Look at me. Only at me." "What's happening out there?" he said. "I heard someone yelling. I need you to breathe with me. In through your nose, slow. Hold it. Out through your mouth." She demonstrated. Do it with me. There are people with guns, he said. I know, and I am handling it. Your job right now is to keep your breathing steady, keep your body quiet, and trust me. That's all you have to do. Can you do that? He looked at her for a moment with the particular expression of someone deciding whether another person is telling them what they need to hear or what is actually true. You're really calm, he said. Yes, she said. That either means everything is fine or you're terrifying. Breathe, she said. She left him and moved to the third bay where Keisha Williams, 29 years old, had come in by ambulance with a head injury from a car accident. Keisha was sedated. She was not going to be a variable in the near term. Amara stood at the edge of the curtained area and looked back into the main body of the ER. Webb had positioned his men with some thought. One at the main doors, one at the ambulance bay entrance, one covering the hallway that led deeper into the hospital. The young, nervous one was moving along the perimeter of the waiting room, keeping the patients and staff against the walls. Webb himself was in the center, and he still had Martin Chu, who had not been allowed to sit back down, standing close enough that any angle shot was not a clean one. She counted 17 people in the waiting area. 6 staff she could see, including Sandra and 2 other nurses, a physician's assistant named Trevor, who had gone very still the way large men sometimes did when they were processing the possibility of action, and 2 orderlies. The rest were patients or family members. The man Webb had placed at the hallway entrance was facing inward, which meant his back was to the corridor. That was a positioning error that told her something about their training level. Thorough enough to have a plan, not thorough enough to have thought through every angle of the execution. She filed it. Webb's phone buzzed in his jacket pocket. He pulled it out, looked at it, and for the first time something crossed his face that was not calculation. It was impatience. Hobbs, he said. Sandra Hobbs, behind the triage desk, flinched at the sound of her name. Your charge nurse. That's you, Webb said. Yes, Sandra said. Her voice was remarkably steady. Amara made a note. I'm going to ask you one question, and I want a straight answer. Do you have a patient here under the name Archer, first name James, possibly admitted under an alias? Came in sometime in the last 72 hours, male, early 50s, abdominal wound. Sandra said nothing for a moment. Her eyes moved just slightly toward the hallway. It was the smallest thing. It was enough. Webb saw it. That's a yes, he said. Good. We're going to go find Mr. Archer together. You are going to take me to him. I can't leave my station, Sandra said. It was the wrong thing to say, and she knew it before it finished leaving her mouth. That wasn't a conversation, Webb said. That was an instruction. Amara watched the exchange with the part of her brain that had been calibrating threat levels in real time since the moment Webb walked through the door. James Archer. She did not know the name, but the way Webb had said it, with that particular combination of certainty and controlled aggression, the way his man at the hallway entrance had shifted his weight when the name was spoken, told her that this was not opportunistic. This was surgical. They had come here with intelligence. Someone had given them the patient's name, the hospital, possibly the ward, which meant this was not a random armed robbery. This was an extraction, possibly an assassination. And that changed the geometry of everything. Sandra, Amara spoke across the room, projecting just enough to carry without shouting. Webb turned toward her. If you're going to move through the hospital, you need me with you. James Archer, if he's post-surgical with an abdominal wound, is going to be on pain management. If you don't have someone who knows his chart, who knows what he's on, you risk destabilizing him before you get to where you're going. It was not entirely a lie. It was the kind of truth that had enough scaffolding around it to stand up. Webb looked at her again. There was something in his assessment this time that was different from before. Not warmer, more careful. You know this patient, he said. I know what an abdominal wound patient needs, she said. You want him ambulatory. You need someone who can manage that. You're very helpful, Webb said. The way he said it was not a compliment. I'm a nurse, Amara said. It's what I do. He made a decision the way practiced people made decisions quickly without visible deliberation. Fine, you come. You stay next to Hobbs. You make one move I don't sanction, and I put a bullet through that old man sitting in the chair. Martin Chu still standing, with the careful dignity of a person who had decided that dying on his feet was acceptable, but dying afraid was not looked at Amara. His eyes were steady. Amara looked back at him for exactly 2 seconds. It was the kind of look that communicated something that could not be put into language in real time, a kind of contract between people who understood what the stakes were. She stepped out from behind the curtain. Trevor, the physician's assistant, moved. Not much, not aggressively. He shifted his weight and his shoulder came forward half an inch, and it was enough. The young nervous one was on him, immediately the rifle up and in Trevor's face, and the room went electric. "Don't," Amara said. She was not talking to Trevor. She was talking to the young one. She said it in the tone, not loud, not soft, the specific frequency that cut through panic the way a tuning fork cut through noise, and the young one's eyes moved to her. "He moved because he is scared," Amara said, "not because he's a threat. Look at his hands, both of them. See that he's not reaching for anything. He's just scared, same as everyone else in this room. Let him go back to the wall." A beat, 2 beats. The young one looked at Webb. Webb made a small gesture with his chin. The rifle came down. Trevor went back to the wall. He was shaking. Amara could see it from across the room. "Thank you," she said to Trevor, which was not a logical thing to say, but was the right thing to say because it gave him something to anchor to. He nodded, his breathing slowed by measurable degrees. Webb was watching her. "Move," he said. She moved. The corridor that led deeper into Veterans Memorial was long and institutional, the kind of hallway that existed in every hospital built between 1960 and 1990, fluorescent and wide enough for 2 gurneys to pass each other. Webb positioned himself behind Amara and Sandra, with his second man broader and older than the nervous one bringing up the rear. Sandra was walking the way people walked when they were trying to hold themselves together through sheer force of will, small careful steps, shoulders tight, chin slightly down. "You're doing great," Amara said quietly. "Don't talk to her," Webb said from behind. Amara did not respond. She was counting doors, mapping. The hospital's layout was something she had memorized in her first week, not the way most people memorize workplace geography as a way of knowing where the break room was, but the way she memorized any operational space, exits, utilities, blind spots, choke points. Second corridor left, there was a stairwell. 30 feet past that, a maintenance room that connected to the parallel service corridor. She was not going to need either of them yet, but she was going to need to know where they were. Webb's phone buzzed again. He answered it this time, a single word, "Yeah," and then "listen." His jaw tightened. "What floor?" he said. Whoever was on the phone said something. They moved him. Webb's voice changed in a way that Amara cataloged immediately. The control was still there, but something underneath it had shifted. This was new information. Unwelcome information. The extraction had a variable in it that his intelligence had not accounted for. He ended the call. "Change of plan," he said. "Which floor is protected care?" Sandra looked at him. "3rd floor," she said, "north wing." "Then we're going up." Amara kept her face neutral. She kept her pace even. But inside the framework of her training, something clicked into a different configuration. Protected care. 3rd floor. That was not a ward you put a regular surgical patient in. That was a ward you put someone in when you needed to control access, when someone official was watching the door. James Archer was not just a patient with an abdominal wound. James Archer had federal protection, which meant Webb's people were going to walk into a corridor with federal agents at the end of it, which meant this was about to go from bad to catastrophic if she did not change the math in the next few minutes. She looked at Sandra. Sandra looked back. In 11 months of working together, they had not been close friends. Sandra was 15 years older, a veteran of the ER in ways that had made her careful and a little guarded. She had been kind to Amar without going out of her way. She was the kind of person who earned respect slowly and gave it the same way. But right now, in the 2 seconds of eye contact they shared in that corridor, something passed between them that was simpler and more immediate than friendship. It was the recognition between 2 people who understood what was happening and understood what was at stake. Amara gave a nearly imperceptible shake of her head. Sandra's eyes asked a question. Amara's answered it, not yet. Sandra turned forward and kept walking. The elevator was at the end of the main corridor. Webb pressed the call button. While they waited, Amara counted his breathing, counted his man's positioning, counted the seconds between when the elevator would arrive and when the doors would open and the geometry of the space would shift. There were exactly 7 variables she had identified that she could potentially control. She had ranked them in order of probability and consequence. She was ready for the doors to open. What she was not ready for was the man who was already inside the elevator when they did. He was wearing a hospital visitor badge and a gray t-shirt, and he had his hands in the front pockets of his jeans, and he looked up when the doors opened with the mild, unhurried expression of someone who had nowhere urgent to be. He was also, Amara knew with a certainty that hit her like cold water, not a civilian. She did not know how she knew. She would not have been able to explain it to someone who had not spent years among people who carried themselves the way this man did. It was something about the stillness, about the way his weight was distributed, about the way his eyes moved from Webb to the weapon and then to Amara and stopped. He stopped there for less than a second, but it was a second that said more than a page of text. She could not signal him. She could not react. Webb's weapon was still close to Sandra's back, and any sudden change in the room's composition would put Sandra at the highest risk. She stepped into the elevator. He stepped back to make room. Webb and his man came in behind her. The doors closed. 5 people in an elevator. One of them armed and 2 of them trained for exactly this kind of thing, and the geometry of that small enclosed space now made it the most dangerous room Amara had been in since a basement in Kandahar 7 years ago. She kept her eyes forward. The man in the gray shirt kept his eyes on the floor numbers. Webb's man was behind them both. The number ticked from 1 to 2, from 2 to 3. The doors opened. And at the end of the corridor, exactly where she had expected them to be, 2 federal agents in plain clothes stood outside a room. They saw Webb's weapon at the exact moment Webb saw them. Everyone moved at once. And Amara Mensah, who had spent the last 11 months being invisible, made a choice that she had known since the moment she set down her coffee cup in the ER that she was going to have to make. She stopped being invisible. The doors opened and the world compressed into a single breath. Amara did not think. Thinking in the truest sense of the word was too slow for what the next 4 seconds required. What she did instead was something that existed below thought, below language, in the part of the nervous system that had been trained over years until it operated independently of the conscious mind. She read the room the way a musician read a chord, all at once, every note simultaneously. 2 federal agents at the end of the corridor, both registering Webb's weapon, both reaching. Neither of them fast enough because they had not been expecting a weapon at this distance, at this angle, with a civilian woman standing between them and the threat. Webb's man behind her starting to raise his rifle. The man in the gray shirt to her left already shifting his weight. Sandra directly in front of her, frozen. Webb to her right and slightly behind the weapon, now coming up toward the agents. 4 seconds, maybe 3. She grabbed Sandra by the upper arm and pulled her hard to the left into the alcove of the elevator's inner wall, and in the same motion she dropped her weight and drove her right elbow back into Webb's forearm with enough force to break the angle of his aim. The shot he fired went into the ceiling. The sound of it in that enclosed metal space was not loud the way thunder was loud. It was loud the way a physical blow was loud, something you felt in your chest and your back teeth simultaneously. The man in the gray shirt moved on Webb's man. He was good. Amara caught it in the periphery as she came up and forward, getting outside Webb's arm, controlling the weapon, hand driving her knee into his thigh to buckle the base, and then she had his wrist at an angle that the physics of the human joint did not permit resistance to. The weapon dropped. It took 11 seconds. She knew because she counted. The 2 federal agents were down the corridor at a run. One of them had his weapon out and trained. He was shouting something. The words were there, but she processed them later because the immediate variable was Webb, who had not gone down, who was bigger than most men she had neutralized in practice, and who was angrier than she had accounted for. He hit her, not with technique, with mass. His forearm caught her across the shoulder and drove her into the elevator wall, and her vision went white at the edges for exactly 1 second. Sandra screamed, short, sharp, immediately controlled. The federal agent was at the elevator door now, weapon at Webb's back. Federal agent down now. Webb went still, not compliant, still. The way a person went still when they were calculating whether the math still worked. It doesn't, Amara said. He looked at her. She was straightening up her shoulder, already registering a level of pain she cataloged and set aside. The math, she said, it doesn't work anymore. Your man downstairs doesn't have a clean room. Your intel on Archer's location was wrong, or you'd have gone directly to this floor without needing us. And now you have 2 federal agents behind you and whatever I am in front of you. She kept her voice even. Put it down. Webb looked at her for a long moment. In that moment, she could see him revising everything he thought he had walked into this morning. He put his hands up. Not the weapon, his hands. The weapon had already been on the floor for 20 seconds. The federal agent moved in fast and had Webb against the wall in the next breath. The man in the gray shirt was next to Amara now. He had zip restraints on Webb's man already. He looked at her sideways with an expression that was not quite a smile and not quite surprise. "You work here," he said. "I'm a nurse," she said. "Sure," he said. His name she learned about 4 minutes later when the corridor was secured and Sandra was sitting in a chair someone had pulled from a nearby room, with her head between her knees doing the breathing exercises Amara had taught her in the elevator, was Cal Briggs. He was attached to the U.S. Marshal Service. He had been sitting with James Archer for the last 6 hours as a secondary detail, because the primary intelligence had indicated the threat was low and the hospital environment was considered controlled. "How'd they get in?" he said. It was not a question aimed at her specifically. He was thinking out loud, moving through it. "They came through the ER," Amara said. "Main waiting room, 5 men that I counted, possibly 6, one positioned at the ambulance bay before they made their move. They had a name and a general location, but not the floor, which means their inside information was partial." Briggs looked at her differently now. "You're telling me you were counting them from the beginning?" "I was doing my job," she said, which included paying attention. He let that sit for a moment. Down the corridor, his partner was on a radio talking fast. The 2 men from the elevator, Webb and his associate, were seated against the wall with their hands restrained, and Webb was staring at the floor with the particular expression of a man recalculating every decision he'd made in the last 48 hours. "There are 4 more downstairs," Amara said. "One is young and running high on adrenaline. He's the one most likely to do something stupid if this drags out. You need to get a communication down to the ER before your backup team hits that room in the wrong formation." "How do you know my backup formation?" Briggs said. "I don't," she said. "I know standard tactical entry patterns for a hostage situation in an enclosed medical facility. You are going to come in from the main doors and the ambulance base simultaneously, which means the young one who is stationed between those 2 points is going to feel surrounded. Surrounded and afraid is a combination that produces outcomes nobody in that room can afford." Briggs stared at her for 3 seconds. 3 seconds was a long time for a man who operated the way he did. "Who are you?" he said. "Amara Mensah," she said. "RN 11 months at this hospital." Before that, she met his eyes. That's a longer conversation. He made a decision the way she had watched Webb make decisions quickly, without deliberation, but his decision had a different quality to it. Webb's decisions had been made from the outside, from the calculation of force and outcome. Briggs's decision was made from something that looked more like recognition, like he was reading the same information she was and arriving at the same conclusion. "Stay close," he said. She stayed close. The radio communication went down to the ground floor team in the next 90 seconds. She listened to Briggs give the modified approach, saw his partner nod and adjust the relay, and she began mapping what was happening 1 floor below, in her mind running the scenario forward, counting for the variables she knew and flagging the ones she didn't. Sandra came up beside her. She had stopped shaking. Her color was still not great, but her eyes were clear. "You want to tell me what just happened?" Sandra said. "We contained the situation on this floor," Amara said. "That is not what I'm asking, and you know it." Amara looked at her. Sandra Hobbs had 22 years in emergency medicine. She had seen things that most people would not survive seeing, and she had walked back into the ER every morning after each of them. She was not asking because she was frightened. She was asking because she was owed the truth and she knew it. "I had some prior training," Amara said, "before nursing." Sandra's expression did not change. It settled, which was different. "Some prior training," she repeated. "Yes. The kind that involves knowing how to break a man's grip while he's got a loaded weapon in a moving elevator. Among other things." Sandra was quiet for a moment. "You know what the worst part is?" she said. "I'm not even surprised. You've always been too calm. I thought it was just your personality." "It partly is my personality," Amara said. "What's the rest of it?" Amara almost smiled. "Training." The radio crackled. Briggs moved to answer it, and his partner intercepted him with a gesture that meant something had changed. Amara watched the exchange, read the body language, and felt the information arrive before she heard the words. Something was wrong downstairs. She moved. Briggs caught her by the arm. "Where are you going?" "The ER," she said. "You need to stay on this floor. One of my patients is down there without a nurse," she said. And whatever just came through on that radio means your team hit a complication. You need eyes in that room that aren't wearing body armor because body armor changes how people react. And right now, the reaction is the whole problem. He held her arm for 2 more seconds. She did not pull against it. She waited. He let go. She went. The stairwell was faster than the elevator, and she took it at a pace that was not quite running, because running in a hospital corridor communicates panic, and panic was the last thing she needed to carry into that room. She pushed through the stairwell door at the ground level and took the short corridor back toward the ER entrance. She could hear it before she got there, not screaming, worse than screaming, arguing. The jagged, escalating exchange of voices that meant someone's nerve was fraying and the people trying to manage it were losing ground. She pushed through the doors. The young one, whose name she still did not know and might never need to, was standing in the center of the waiting room with his rifle at his chest and 3 of his associates behind him, and facing him from the far side of the room were 2 members of what was clearly the federal entry team, their body armor obvious under jackets that had not been designed to conceal it at close range, their weapons holstered in a gesture of non-escalation that the young one was not reading as non-escalation at all. He was reading it as a trap. "I told you, back off," he was saying. His voice had gone up half a register from where it had been when Amara left. "I told you, back off, and you're still standing right there. You think I don't see what you're doing? You think I don't know what comes next?" The federal agent holding the negotiating position was a woman mid-30s. Dark hair, the particular stillness of someone trained to hold a position under pressure. She was good, but she was an unknown quantity to this young man, and unknown was not what he needed right now. Martin Chu was still standing. He had been on his feet for more than 20 minutes now. His face was gray in a way that had nothing to do with fear, and everything to do with the kind of fatigue that a 72-year-old man with a chest complaint should not be sustaining. The patients against the wall, the nurses and Trevor all still in position. She scanned the room, cataloging. Raymond Okafor behind the curtain, still on his monitor. She could hear the steady pulse of it. Daniel Park quiet, which meant he was either calm or he had fainted, and she would deal with that in a moment. Keisha Williams sedated, stable, unless something else had changed. The room was holding, but holding the way a cup held water when you had filled it past the rim, a single vibration away from spilling. She walked into the center of it. Every eye in the room moved to her, including the young ones, and she used the 2 seconds of that collective attention the way she used every resource available to her, deliberately and without waste. "Hey," she said. The young one looked at her. Recognition. She was the nurse he'd pointed his rifle at earlier, the one Webb had let stay with the patients. "What happened upstairs?" he said. His voice was demanding something from her, but she wasn't sure he knew what it was. "It got complicated," she said. She was walking toward him as she said it. Not fast, the pace of someone who belonged in the room. "Stop moving," he said. She stopped. She was 10 feet from him now. "Where's Marcus?" he said. Webb's first name, Marcus. She filed it. "I don't know where he is right now," she said. "I know that this situation is reaching a point where decisions are going to get made whether you make them or not. And when other people make your decisions for you, they usually don't make them in your favor." He stared at her. "You're a nurse." "Yes." "You were up there with them." "Yes." "What does that mean?" His voice cracked on the last word. Not from weakness, from the particular strain of a person who has been running on adrenaline for too long and whose body is starting to send signals that the brain is not ready to receive. "It means the situation changed," she said. And it means you're the one in this room right now who has to decide what happens next. Not Marcus, not anyone upstairs, you. Something moved across his face. She could see him feeling the weight of that land, the way the responsibility of it pressed down on someone who had come into this room believing he was following someone else's plan and now found himself holding it alone. "They were supposed to be in and out," he said, more to himself than to her. "I know," she said. "It wasn't supposed to go like this." "It never is," she said. Martin Chu made a sound. It was soft and voluntary, the kind of sound a body made when it was done waiting for the mind to catch up. He put his hand on his chest. Amara moved before the young one could process what was happening. She covered the space between herself and Martin in 4 steps and got her hand on his arm before his legs gave out and she lowered him to the ground with a controlled descent that kept his airway open and his head from hitting the floor. His skin was cold and damp. "I need someone to get me a defibrillator," she said loud and clear and entirely without panic. "Trevor, the cart behind the nurse's station. Now." The young one said something. She did not process the words. She had 2 fingers at Martin's carotid and she was counting. Trevor moved. One of the federal agents moved with him. The young one raised the rifle and then lowered it and then stood there with it at his side like he didn't know what to do with his own hands. "His heart is throwing a rhythm," Amara said. She was not saying it to the young one. She was saying it to Sandra, who had appeared at her shoulder, which meant Sandra had come down the stairwell behind her. "Get me the leads. I need to see what we're dealing with." Sandra was already moving. "What's your name?" Amara said to the young one. She was working while she spoke, her hands on Martin, her eyes on what her hands were doing, her voice calibrated to reach him across the room. A pause. "Dion," he said. "Dion." She said it the same way he had said it, without inflection, just confirmation that she had received it. Martin is 72 years old and he came in this morning for a chest x-ray, which means he already knew something was wrong with his heart before any of this started. "This is not your fault. But if I don't help him right now, he's going to die on this floor, and that is a weight that I promise you don't want to carry for the rest of your life." Silence. "Let me help him," she said. "That's all I'm asking." The room waited. Dion lowered the rifle to his side. "Do what you have to do," he said. His voice was different now. Not soft exactly, depleted, like something had gone out of it. Trevor was back with the cart. Sandra had the leads. Amara worked. Martin Chu's heart was in atrial fibrillation, with a rate that was trending in a direction she did not like. She talked through it in a low, steady voice, not for anyone in particular. Partly for Sandra, partly because verbalizing a clinical assessment was something she had always done, a habit from a different kind of work, where talking through your process out loud kept your team oriented in high-noise environments. "Rates at 140, irregular. No chest pain that he can communicate to me right now, but his color's changing. We need to get him stable before we talk about moving him." The federal negotiator, the woman, had moved 2 steps closer during the resuscitation effort. She was not advancing on Dion. She was orienting toward the patient the way people with any human instinct at all oriented towards someone who needed help. It was a small thing, but Amara saw it and filed it. Dion saw it too. "She comes any closer," he said. "She's not coming closer," Amara said. "She's watching the same thing you're watching. Nobody wants this man to die." Dion looked at Martin Chu on the floor. Martin was conscious, barely, his eyes open, and tracking his hand, still pressed to his chest. "I didn't mean for any of this," Dion said. Amara did not answer immediately. She was adjusting the leads, reading the monitor, making a calculation. Then she said, "I know, but we don't get to undo things, Dion. We only get to decide what we do from here." Martin's heart responded to the medication Sandra pushed through a line they had established in 90 seconds flat. The rate began to come down. Not all the way, but enough. His color shifted incrementally towards something that was not alarming. Amara sat back on her heels and exhaled through her nose. The room was different now. She could feel it. Not safe, not resolved, but different. The temperature of it had changed in a way that was not about the air conditioning. When a person in crisis sees someone else's body fail and then watches someone else hold that body back from the edge, something shifts in the collective nervous system of the room. Dion had come into this hospital with a mission and a weapon and a plan. He had not come in prepared for Martin Chu. Most people weren't prepared for Martin Chu. That was the thing about crisis. It introduced variables that no one had factored in, and those variables were always human. Briggs appeared at the ER door. He had come down, she realized. He had followed her, or he had moved independently to the same conclusion. He was in the doorway just inside, and he was reading the room the same way she was, and when his eyes found hers, she gave him the smallest possible signal. Not yet. He held his position. One of Dion's associates, the one who had been near the ambulance bay, moved toward Dion. She heard him say something in a low voice. Dion shook his head. "It's done," Dion said. The associate said something else. His voice was harder. "I said it's done," Dion said, louder now. The associate grabbed him by the arm. And then Trevor, of all people, Trevor, the physician's assistant who had been against the wall shaking for the better part of an hour, stepped forward and said in a voice that had no business being as steady as it was, "Take your hands off him." Every head in the room turned. Trevor was not a small man. He was 6'2", broad through the shoulders, former college football, and right now he was standing up straight in a way he had not been standing since Webb first walked through the door, and he was looking at the associate with an expression that had moved past fear and arrived somewhere quieter and more resolved. The associate turned. Trevor did not back down. It was a marathon, possibly the bravest thing she had seen in this room, and she had watched Martin Chu stand on his feet for 20 minutes with a gun to his head. Dion pulled his arm free from the associate himself. He looked at his own weapon. He looked at Martin on the floor. He looked at Amara. He set the rifle down. The associate took one step toward it, and Briggs was moving, and three things happened at once. And when they were done, Dion was on his knees with his hands behind his head, and the associate was against the nurse's station with 2 federal agents on him, and the room was full of the sound of people breathing. Just breathing, the enormous simple relief of it. Amara turned back to Martin. "Stay with me," she said. "You hear me, eyes open." Martin Chu, 72 years old, retired postal worker. A man who had not asked for any of this morning, looked up at her from the floor and said in a voice that was thin but entirely present, "I'm not going anywhere." "Good," she said. "Neither am I." Martin's heart rate held at 94, and Amara kept her 2 fingers at his wrist, counting not because she didn't trust the monitor Sandra had rolled to his side, but because touch told you things that machines sometimes missed. The quality of the pulse, the temperature of the skin, the faint tremor in a hand that was trying to hold itself still. Martin Chu had all 3, and what they told her was that his body had taken everything it was going to take gracefully. The rest of the work was going to require a room with a proper bed and 48 hours of monitoring, and the kind of quiet that Veterans Memorial Hospital had not been offering since 7:48 that morning. "We need to move him," she told Sandra. "Cardiac wing, not the elevator, the north ramp." Sandra was already moving before the sentence was finished. 22 years of working together with whoever stood across from her in a crisis had made her fluent in the shorthand of necessity, and right now, necessity was speaking clearly. Briggs appeared at Amara's shoulder. He had the look of a man who had successfully locked down a situation and was now operating in the 12-second window between one crisis resolving and the next one beginning. She recognized that look. She had worn it herself more times than she had counted. "ER is clear," he said. "My people have the 4 from down here. Webb and Reyes are in federal custody on 3. Building's going into lockdown." "Reyes," she said. "Webb's second, the one from the elevator." She filed the name. "What about the 6th man?" Briggs paused, half a beat, but she caught it. "You identified 6, she said. "I said possibly 6 at the time. The ambulance bay position, the 4 in the waiting room, Webb, and 1 more that I flagged as potential external coverage. Did your team account for him?" Briggs looked at her steadily. "We're running the exterior." "That's not the same as accounting for him." "No," he said, "it's not." She stood up from Martin's side. Sandra and Trevor were managing the transfer preparation. The orderly was bringing the transport gurney, and the room had settled into the particular focused motion of medical professionals reclaiming their space from people who had tried to take it. Amara watched it happen with something she could not quite name, something between relief and the restlessness of a body that had calibrated for a higher level of threat and had not yet received the signal that the calibration was no longer necessary. "I need to see Archer," she said. Briggs turned to look at her fully. "Why?" "Because your extraction plan assumed a threat vector from outside the hospital," she said. 5 to 6 men, ground-level entry, direct approach. That plan worked well enough until it didn't, and whatever intelligence Webb had coming in was partial, but it was specific. Someone told them the patient's name, the hospital, and a general floor. That's not random, that's sourced. We're aware of the leak concern. Then you understand that me walking into Archer's room is the least of your security problems right now. He considered that. She had a feeling Cal Briggs spent most of his professional life making considerations that needed to happen in 3 seconds or less, and that he had become very good at it. "Come with me," he said. The 3rd floor north corridor was a different kind of quiet from the quiet of the ER. The ER's quiet had been violent in its origins, the sudden compression of chaos. This quiet was institutional, the kind of quiet that came from controlled access and reinforced doors, and the particular loneliness of a person who had been removed from the ordinary world for reasons that were not yet fully resolved. A federal safe room inside a hospital. She had seen them before. Not often and not recently, but often enough to know what she was walking into when Briggs produced a keycard and held it to the panel outside room 317. James Archer was awake. That was the first thing she registered. She had expected sedation, expected the heavy-lidded flatness of a man in surgical recovery on pain management. Instead, he was sitting up against the raised head of the bed with his hands folded in his lap and his eyes on the door when it opened. And the quality of his alertness told her that whatever had been done to his body in the last 72 hours, his mind had not followed it into recovery. He was 53 years old, medium build or had been before whatever had taken 18 pounds off him in what she guessed was the last 3 weeks. Gray at the temples, a jaw that had been square once and was still trying to hold that shape. An abdominal wound dressing visible above the edge of the blanket. His eyes moved from Briggs to Amara and stopped. "Who is this?" he said. "Nurse from downstairs," Briggs said. "She's the reason your extraction team didn't walk into a hall full of Webb's people an hour ago." Archer looked at her the way Webb had looked at her, the way Briggs had looked at her, the way people looked at her when they were revising the category they had initially placed her in. But there was something different in Archer's version of that look. It was not surprise. It was closer to recognition, and that made no sense to her yet. "What's your name?" Archer said. "Amara Mensah." Something happened in his face. It was small, a barely perceptible settling, as if a calculation had completed and returned a result he had already suspected. "Sit down," he said. "I'll stand," she said. "What happened to you wasn't surgical. The wound pattern is wrong for a procedure that was planned. What were you shot with?" Archer's mouth moved in something that was not quite a smile. 9mm, close range. Through and through right side, missed the major vessels by about half an inch, which my surgeon tells me was either extraordinary luck or divine intervention. I'm not sure I believe in either at this point. "Who shot you?" Briggs said her name. She held up one finger in his direction, not dismissively, but as a placeholder, and kept her eyes on Archer. "Somebody who didn't want me talking to the people I was about to talk to," Archer said. "About what?" He looked at Briggs. Briggs gave a very slight nod. "About a program," Archer said. "A program that operated outside authorized channels for approximately 6 years. Military-adjacent, intelligence-funded, theoretically deniable. It recruited operators from Tier 1 units and some unconventional sources, ran them through modified training protocols, and deployed them into situations that could not be officially acknowledged." The room temperature did not change. Nothing in Amara's posture changed. Her breathing did not change. But something behind her eyes shifted, and Archer saw it. "You know what I'm describing," he said. "I know a lot of things," she said. "The program had a name internally," he said. "People who went through it called it the Meridian Track. Officially, it didn't exist. Unofficially, it recruited people from medical backgrounds and cross-trained them because in the environments they were operating in, a person who could stop bleeding and neutralize a threat in the same 30-second window was more valuable than 2 separate specialists." The silence in the room was total. "Why is Webb after you?" she said. Her voice was perfectly level. "Because I have documentation," Archer said. 18 months of records I was able to pull before they burned the server. Names, deployment orders, funding chains. Webb ran operational logistics for Meridian for 4 years. If my testimony reaches the Oversight Committee next week, Webb goes to federal prison, and he takes 11 other people with him. People who currently hold positions that would be significantly inconvenienced by that outcome. "Who recruited you to testify?" she said. Archer looked at her again with that look that was not quite recognition, but was circling it. "A federal investigator named Delgado. She reached out 8 months ago. And someone inside that communication chain told Webb where you were." "Yes." Amara moved to the window. She did not look out. She stood with her back to Archer and Briggs, and she breathed through the information, letting it arrange itself into the shape it was actually in, rather than the shape she was instinctively trying to force it into. Meridian. She had not heard that word spoken aloud by another person in 4 years. She had heard it in her own head at 4:30 in the morning during the conversations her past tried to have with her when she was trying to sleep. She had heard it in the specific way a person heard the name of something they had chosen to leave, not erased, not denied, simply placed in a different room and closed the door on. She turned back. The documentation you pulled, she said, does it include personnel files? Archer said nothing for a moment. Then some. Is my name in it? Briggs straightened slightly. She did not look at him. Archer said, there's a file with your operational designation, not your real name. The investigator cross-referenced it 6 weeks ago, and that's when Delgado reached out to us about whether you might be relevant to the case. Relevant, she said. What does that mean? It means you were one of the program's most successful graduates, and you were never formally debriefed when it was shut down, which means your knowledge of Meridian's operation is potentially corroborating testimony. It also means you were on a list of people Webb was going to need to deal with before the oversight hearing. The sentence landed with a weight she had not fully anticipated. She had understood from the moment she identified Webb's training in the ER that this situation was connected to something larger than a hospital breach. She had not fully followed the line to its end. Webb had not come to this hospital only for Archer. How long has Webb known I was here, she said. Briggs answered, we think 3 weeks. When the inside contact identified Archer's location, they pulled the full staff manifest. Your name flagged in their system because your operational designation was already active in the threat assessment. She looked at Briggs directly. You knew this. We suspected it, he said. We didn't have confirmation until about 40 minutes ago when we pulled Webb's phone. There's a message from his contact with your name on it. Your real name, not the designation. She held that for 2 seconds. You were going to tell me. I was going to tell you after the situation was contained. The situation being me. Briggs had the decency not to look away. Among other things, she pulled the pieces together, the whole picture of it. Webb coming into the ER with partial intelligence needing to move through the hospital, needing guides specifically asking for the charge nurse. He had not known what she looked like. He had not known she was in that room when he walked through the door. He had been working from a name on a manifest and a room number and an operational priority that included her as a secondary target. And then she had walked up to him and offered to help. She almost wanted to laugh. She did not. What's the name of the inside contact, she said. We're working on confirming, Briggs said. You have Webb's phone. Identifying information in the message chain is encrypted. We have a technician working on it. How long? Hours, maybe more. You don't have hours, she said. If Webb's contact knows the extraction failed, they're going to move. They're going to move on the documentation, they're going to move on the communication trail, and they're going to try to sanitize whatever they can before the oversight hearing. I know that. Then you need the contact name in minutes, not hours. Briggs looked at her. Do you have a way to get it in minutes? She looked at him. Then she looked at Archer. Then she walked back toward the door. I need to talk to Webb, she said. Briggs took 1 step in front of her, not blocking her, planting himself in her path as a statement of intent. That is not happening. He came into my hospital, she said. He put a gun to a 72-year-old man's head. He had my name on his phone and a plan that involved me not walking out of this building. I am not asking for permission. I am telling you what is going to produce a result before your window closes. You're a nurse, Briggs said. Stop saying that like it's the most important thing about me, she said. He held her gaze. Behind them, Archer made a sound that was somewhere between a cough and an exhale. Let her, Archer said. Briggs turned to look at him. I've been sitting in this room for 3 days reading the file on Meridian's graduates, Archer said. I know what she's capable of, and I know that if the contact moves that documentation before the hearing, everything I went through to get here and everything Webb put this hospital through this morning means nothing. Let her talk to him. The hallway outside Webb's temporary holding position was monitored by 2 of Briggs's people. Webb had been moved to a room at the far end of the 3rd floor corridor, and when Amara pushed the door open and walked in, he was seated in a chair with his wrists restrained to the armrests and his chin up and his eyes on the wall opposite. He did not look like a man who had been defeated. He looked like a man who was calculating what came next. He looked at her when she entered. You, he said. Me, she said. She pulled the chair from the desk in the corner and set it across from him and sat down with her hands in her lap, unhurried. You want to tell me about the contact? I want to tell you nothing, he said. That's fair, she said. Let me tell you some things then. Your extraction failed. Dion is in federal custody downstairs. Reyes is in federal custody across the hall. The 3 men you left in the ER are in federal custody in the parking structure. You are sitting in a chair with your hands tied and a federal case building around you that is going to be airtight by the time it reaches a courtroom. I've seen cases like this. I know how they go." Webb said nothing. "The contact," she said. "The person who fed you Archer's location and my name. They are moving right now. Every second you sit here protecting them is a second they're using to build a wall between themselves and the outcome you're both facing. When they finish building that wall, you're on the outside of it, alone." "You're good, Mr. Webb said. "The speech is good." "It's not a speech," she said. "It's arithmetic." He looked at her with the flat appraisal she had clocked in the ER. Up close, it was more complex than it had appeared from across the room. There was something in it that was not just calculation. There was something that looked faintly like curiosity. "You were Meridian," he said. "I was a lot of things," she said. "Meridian graduated 11 people over 6 years," he said. "I know their files. I ran logistics for 4 years, which means I moved the money and the personnel and the equipment, and I know those files better than the people who made them. I went through every one of them 3 weeks ago when this whole situation started accelerating. There was one that didn't close cleanly. One operator who was never formally debriefed. One person who walked out of the program and became a nurse in Baltimore and then showed up at this particular hospital 11 months ago." He leaned forward as far as the restraints allowed. "You didn't come here by accident." The room went very still. "Neither did Archer," Webb said. She kept her face neutral. Her pulse was exactly what it had been when she sat down. "What are you saying?" she said. "I'm saying that the federal investigator who reached out to Archer 8 months ago reached out to 2 other people around the same time. And one of those people was you. And I'm saying that your presence at this hospital in this city at this specific moment in time is not the coincidence it was filed as." She looked at him. He looked back. "You already knew about Meridian before today," he said. "You already knew about the oversight hearing. And somebody sent Yao here to make sure Archer made it to that hearing alive." The silence held for a full 4 seconds. Then the door opened and Briggs stepped in and looked at Amara and said, "We have a problem." She stood. "The 6th man," she said. It was not a question. Briggs's jaw was tight. "He made entry on the service level 12 minutes ago. We think he's already in the building." She was moving before he finished the sentence back through the door, into the corridor, running the geometry of the hospital in her mind, mapping the service corridors, the utility routes, the paths that a man who knew buildings could use to move between floors without passing a single camera. There was one route that connected the service level to the 3rd floor north without a single point of federal coverage. It ran directly past room 313. Keisha Williams was still in room 313, sedated, alone. A 29-year-old woman with a head injury who had come in by ambulance and been placed in that room because it was the closest available bay when the ER went into lockdown. Room 313 was directly adjacent to the maintenance shaft that connected every floor of the north wing. Amara ran. Behind her, she heard Briggs issuing orders into his radio, heard the sound of footsteps coming fast from the far end of the corridor, heard the building's lockdown alarm change pitch in a way that told her the lower levels had just been sealed. She hit the stairwell door at a run and took the stairs in the way she had been trained to take them fast and controlled with her weight forward and her hands free. She got to room 313's corridor at the same moment that the maintenance access panel at the far end of it opened. The 6th man stepped through. He was larger than Webb, and unlike Dion, unlike the nervous ones who had started this morning running on adrenaline and poor planning. This one moved with a deliberate economy that told her immediately he was the most dangerous person she had faced since 7:48 a.m. He saw her at the same moment she saw him. He reached into his jacket. She was already moving. She did not have a weapon. She had known since the moment she walked out of the ER without stopping at the security cabinet that this was a variable she was operating around rather than with, and she had built every decision since then on the assumption that her body and her training were the only tools available to her. For 8 years, that had been enough. She was betting in the 4 seconds it took to close the distance between herself and the 6th man that it was still enough. He was fast, faster than his size suggested, which meant he had been doing this long enough to have corrected for the instinct to lead with mass. He brought the weapon up and she was already past the angle of it, driving her forearm into his wrist and redirecting the line of the barrel toward the wall and the shot he managed to get off went into the plaster 18 inches from the doorframe of room 313. She registered the sound of that shot the way she registered everything in motion as information, not as shock. Keisha Williams was behind that door, sedated. The shot had gone wide. The door was intact. She had approximately 2 seconds before he recovered and recalculated. She used them. The technique she applied had no formal name in the program. It was a compression of 3 movements into a single action, a controlled collapse of his base, a redirect of his weapon arm, and a strike to the nerve cluster below the collarbone that produced a very specific involuntary response in the shoulder and hand. She had done it 3 times in her life before this morning. Twice in training, once in a situation she still could not discuss. All 3 times it had worked. This time it half worked, which meant his grip on the weapon loosened, but did not break, and he was big enough and experienced enough to roll with it and come back with his elbow into her ribs before she could reset her position. The pain was significant. She breathed through it. He got a hand on her shoulder and drove her into the wall, and for 2 seconds she was pinned with her back against the plaster and his forearm across her chest, and the weapon coming up again in his other hand, and she looked at him at close range and saw in his face the thing she had been half expecting. He was not angry. He was not frightened. He was operating on a professional assessment of the fastest route to his objective, and his face held the particular blank clarity of a person for whom this was a calculation and not a crime. That told her something important. It told her he had a secondary objective. If she had been his primary target, she would already be down. He was moving through her, not stopping at her. Archer, the documentation. The contact wanted Archer silenced before he could reach the oversight committee, and the 6th man had come through the maintenance shaft not to find Amara, but to finish what Webb had started, and Amara was a variable he was planning to eliminate on the way to the real work. She stopped resisting the wall. It was a counterintuitive thing to do, and it worked for exactly that reason. He was calibrated for resistance, and when she gave him none, his weight shifted forward to compensate, and that shift opened 3 inches of space between his forearm and her chest, and she drove her knee up into his midsection and shoved hard off the wall with her shoulders simultaneously. He went back 2 steps. Not down, 2 steps. She was already turning for the stairwell when Briggs came through the door at the far end of the corridor at a run with his weapon up and 2 of his people behind him. Down, Briggs said. She dropped. The corridor was loud for approximately 1 second, and then it was very quiet. She got to her feet. The 6th man was on the floor, not dead zip-tied, with a speed that told her Briggs's people had done this particular piece of work many times before. His weapon was across the corridor, kicked clear. Briggs looked at her. His expression had moved past the point where he was going to comment on her methods or her decision to come down here alone. They had arrived at the other side of that conversation without having it. Clear, she said. Clear, he said. Building's locked top to bottom. All 6 are in custody. She breathed. She put one hand on the wall for exactly 2 seconds, not because she needed to, but because her ribs were telling her something that she was going to need to address soon. Probably a fracture. Possibly 2. She had broken ribs before. They hurt in a very specific way, and right now that specific way was present and accounted for. She moved past Briggs to room 313 and pushed the door open and looked at Keisha Williams, who was exactly as she had left her, sedated and stable, the monitor showing a rhythm that was unremarkable in every good sense of the word. She checked the leads. She checked the IV line. She listened to Keisha's breathing with a stethoscope she had taken from the nurse's station on the 3rd floor and had been carrying in her left pocket for the last 30 minutes. Everything was fine. She stood at the bedside and let the reality of that land for a moment. Behind her, Briggs appeared in the doorway. He watched her work without speaking, which she was beginning to understand was how he operated when he had something complicated to process. He held his silences the way some people held cards waiting for the right moment. "You should get your ribs looked at," he said. "I will," she said. "Who's going to look at your ribs?" "I'm a nurse," she said. "I'll look at my own ribs." "That's not how ribs work." "I've been managing things that weren't supposed to work for 11 months, she said. "I think I can handle ribs." She turned away from Keisha's bed and walked back into the corridor. Briggs followed. The building was going through the particular process that buildings went through after something violent had happened inside them. There was movement everywhere, but it was organized movement, the kind of movement that spoke of after-action protocols and documentation, and the long institutional process of returning a space to what it was supposed to be. She could hear the emergency tones cycling down. She could hear voices, normal-pitched voices, which meant the lockdown announcement had stopped cycling. She needed to get back to her patients. She needed to check on Raymond Okafor's rhythm and Daniel Park's breathing, and she needed to find out if any of the patients in the waiting room required assessment beyond what had already been done, and she needed to call the cardiac attending about Martin Shu because Martin needed a proper evaluation that went beyond what she had been able to provide on an ER floor during an active hostage situation. She also needed to deal with the other thing, the thing Webb had said. She was halfway down the corridor when Briggs said, "Delgado wants to talk to you." She stopped. "She's been on my radio for the last 20 minutes, he said. "She's the federal investigator running the Archer case. She's the one who built the Meridian investigation. She says she's been trying to reach you for 2 weeks. "I know who she is," Amar said. "Then you know she's going to have questions." "She can have questions," Amar said. "I have patience." "Amara," she turned. In 11 months of working at Veterans Memorial, none of the staff had used her first name, the way Briggs just used it, not as a greeting or a label, but as a weight, something he was placing in front of her because he needed her to see it. "What Webb said to you in there," Briggs said, "about you being here for a reason, about Delgado reaching out to you, is it true?" She looked at him for a moment. The corridor was quiet enough that she could hear the ventilation system cycling, could hear 2 of his agents talking in low voices near the stairwell door, could hear her own breathing, which was slightly shallower than usual because of the ribs and because of the accumulated weight of a morning that had started at 4:30 and had not stopped since. "What's true," she said carefully, "is that I am a nurse. I have been a nurse for 3 years. I chose this work because I wanted to do something with my hands and my training that didn't leave bodies on the ground. Everything else is a conversation that requires a different setting. The oversight hearing is in 6 days, Briggs said. "I know. If your testimony is part of Delgado's case." "I said I know," she said, not unkindly, but finally. He heard the finality in it and stopped pressing. She went down the stairwell and back into the ER. The room was different. The patients were still there, some of them, the ones who had not been moved during the lockdown. The staff were there reassembling themselves into the rhythm of the work, to the way people who had spent careers in emergency medicine reassembled themselves through motion, through the familiar handling of familiar tasks. It was how they processed things. It was how she processed things too. Sandra was at the central station. She looked up when Amara came through the doors, and the look she gave her was the look of someone who had been holding a question for a while and was now deciding whether to ask it. "Martin is in cardiac," Sandra said. "They're running a full workup. His rhythm stabilized on the way up." "Good," Amara said. "Raymond Okafor asked about you. I'll go see him. See, Daniel Park's sister is here. She's in the family room. She wants to talk to the nurse who helped him." "I'll go see her too." Sandra watched her move toward the supply cabinet to resupply the items she had used. Watched her take an ace bandage and 2 pieces of medical tape from the second shelf. Watched her move toward the staff bathroom without explanation. She wrapped her ribs herself, standing in front of the mirror, and the pain of it was clarifying in the way that physical pain was sometimes clarifying. It pulled her into the present moment with a specificity that nothing else quite matched. She breathed through each pass of the bandage, and when she was done, she looked at herself in the mirror for a moment. She looked like a nurse, scrubs with a smear of dried blood on the left sleeve, her own from a scrape she had gotten in the corridor she had not noticed at the time, hair still close-cropped and neat, which she thought was almost funny given everything else. The stethoscope around her neck. She had looked like a nurse yesterday. She had looked like a nurse every day for 3 years. The looking had become the being somewhere along the line, and the being was not a performance or a cover. It was a real thing she had built with real intention. But Webb had been right about something she was not ready to say out loud yet. Her presence at this hospital at this time in this city had a context that she had not been entirely honest about. Not with the hospital, not with Sandra, not entirely with herself. 8 months ago, a federal investigator named Delgado had sent her a message through a channel she had thought was dark. The message was 3 sentences. The first sentence contained a single word that was her operational designation from the Meridian program. The second sentence described in precise and accurate terms 4 deployments she had run in a 30-month period that were not in any official record. The third sentence said simply, "We need you in position, Veterans Memorial Hospital. The Archer case needs a closed circle." She had gone back to work at her clinic in Baltimore for 2 weeks after receiving that message. She had run her route to the bus stop every morning and stood in her kitchen at 4:30, drinking coffee that was too strong, and she had thought about what it meant to be asked to step back into something you had chosen to step out of. She had thought about the difference between obligation and duty, and whether those two things were the same or different, and whether it mattered. Then she had accepted a position at Veterans Memorial, and she had moved, and she had started her shifts, and she had been a nurse, a real nurse, a good one, and she had told herself that whatever role Delgado had in mind for her was secondary to that. She was not sure, standing in the bathroom with wrapped ribs and someone else's blood on her sleeve, that she had been entirely right about that. She came out of the bathroom and found Raymond Okafor first. He was sitting up in his bay with his hearing aids back in and his hands folded in his lap, and when she came through the curtain, he said, "There she is," in a tone that was so warm and so uncomplicated that she felt something in her chest release that she had not known was clenched. "Mr. Okafor," she said, "how are you feeling?" "Better than I was," he said, "worse than I would like. But that seems to be the condition of being 78 years old, regardless of armed men in hospitals." He looked at her carefully. "You're hurt." "I'm fine." "You favor your left side when you walk," he said. "You didn't do that this morning." She looked at him. "I was a school teacher for 40 years, he said. "I noticed things. It kept 40 children in line at a time, so you'll forgive me if I continue to notice things now." He leaned forward slightly. "Sit down, child." She sat down on the edge of the chair beside his bed. It was the first time she had been fully seated since before 7:48. "Thank you," he said, "for this morning. I was doing my job." "Your job," he said, with the gentle precision of a man who had spent 4 decades teaching children how to think about words. "Yes, I'm sure that's exactly what it was." She almost smiled. Almost. "Your family is on the way," she said. "Your daughter called the main desk. She'll be here in about 40 minutes. He nodded. "She'll be loud about it," he said. "She has opinions about my health choices." The chest x-ray results came back before everything happened this morning, Amara said. "Your attending is going to want to talk to you about what they showed. I can't speak to the details, but I want you to hear it from someone who is not in a rush. So when he comes in, take your time. Ask every question you have. Don't let him go until you understand every word he says." Raymond looked at her. His kind eyes, which were genuinely kind, held something more now. Something that had been refined by a morning that had made the ordinary world strange and then given it back. "You'll be around," he said. "I'll be around," she said. She found Daniel Park's sister in the family room, a small woman in her late 30s named Gion, who had arrived at the hospital 40 minutes into the lockdown and spent that time in the parking structure, not knowing whether her brother was alive or not. When Amara walked in, Gion stood up so fast the chair scraped back and said, "Is he okay?" in a voice that had been running that question on a loop for the better part of an hour. "He's okay," Amara said. "The procedure went well. He's awake and his breathing is stable. Whatever happened this morning was frightening, but it didn't compromise his recovery." Gion sat back down and covered her face with both hands for a moment. It was the sound of relief, which was not always a happy sound. Sometimes it was the sound of someone releasing everything they had been holding. "I couldn't get in," Gion said through her hands. "They wouldn't let anyone in. I didn't know." "I know," Amara said. "I'm sorry you were out there not knowing. That was the hardest place to be this morning." Gion lowered her hands. Her eyes were wet, and she made no effort to address that. He said a nurse helped him, kept him calm. He said she made him breathe, and he focused on her voice, and it was the only thing that kept him from panicking. "He did the hard part," Amara said. "He made the choice to focus. That's not nothing." "He said you told him to trust you," Gion said. "And he did. He said he doesn't know why, but he just did." Amara thought about that, about the particular transaction between a person in crisis and the person who walked into that crisis and said without any credential other than the steadiness of their voice and the certainty of their posture, "Trust me." She had done it in 2 different professions now. It worked in both of them for the same reason. Not because of training, because of something that lived underneath training, something she had been born with, or had built so early she could no longer separate it from herself. She left the family room and she was in the corridor when Briggs found her again. He had a different look now, not the contained urgency of the active situation, something that had moved past that into a different kind of weight. Webb talked, Briggs said. She stopped. About the contact. About the contact, he said. He gave us a name. We've been running it for the last 20 minutes and it's confirming. Who? She said. Briggs looked at her steadily. Someone inside the hospital. The corridor was quiet around them. The inside contact wasn't federal, he said. It wasn't from Delgado's investigation chain. It was a staff member. Someone who had access to the patient manifest, to the floor assignments, to the staff roster. Someone who had been passing information to Webb's network for at least 3 weeks. She thought about the morning, about the things that had been slightly wrong before Webb walked through the door, about the way his intelligence had been partial, specific enough to be sourced from inside, but incomplete enough to suggest the source was not medical or operational, just administrative, just someone with access to a computer and a reason to use it. Who, she said again. Briggs said the name. She had to hear it twice. Not because she hadn't understood it the first time, because understanding it the first time required her to revise something she had been carrying for 11 months. Something about the texture of this place and the people in it, and that revision was not a small one. The name, he said, was someone she had worked beside every shift, someone who had been in that ER this morning, someone who had been against the wall with the rest of the staff, hands up, looking frightened. Looking frightened. She thought about that word. Looking. Where are they now? She said. We have them, Briggs said. They were picked up 4 minutes ago in the parking structure. They were trying to leave. She stood in the corridor for a moment with that information. The hospital administrator needs to be notified, she said. Patient privacy protocols have been compromised. Every record that person had access to in the last 3 weeks needs to be audited. It's being handled, Briggs said. The patients in this hospital had their information given to people who came in here with guns. She said, that matters. That needs to be said clearly and handled clearly. I understand that, Briggs said, and it will be. She looked at him. And Archer. Archer is secured. We're moving him to a federal facility within the hour. The oversight hearing proceeds on schedule. She nodded. Amara. He said her name again with that weight. Delgado is on her way here. She's going to want to sit down with you. I know. You're going to talk to her. She thought about 4:30 in the morning, about the ceiling and the radiator and the coffee that was too strong, about a 3-sentence message through a channel she had thought was dark, about a choice that she had told herself was secondary and was becoming by the hour clearer, about the degree to which she had not been entirely honest with herself about that. I'll talk to her, she said. She turned back to the ER. She had work to do. She had patients who needed someone steady and present and entirely focused on the reality of their care. She had a wound that was real in hers and not a performance. And she had a conversation coming that was going to require her to stand in a room with a federal investigator and be honest about a version of herself she had spent 11 months putting in a different room with the door closed. She picked up Raymond Okafor's chart from the nurse's station. Sandra looked at her from across the desk. Everything okay? Not entirely, Amara said, but it's moving in that direction. Sandra held her gaze for a moment. You know, whatever happens next, this hospital is lucky you were in this building this morning. Amara looked at the chart in her hand. Then she looked at the ER around her, the patients in their bays, the staff moving with the particular restored momentum of people who had survived something and chosen to keep working anyway. The monitor beside Raymond Okafor's bed showing a rhythm that was steady and present and alive. I know what I'm doing here, she said, and she meant it. She meant it about the chart, and she meant it about the hospital, and she meant it about something larger that she was not yet ready to name out loud. She went back to work. Delgado arrived at Veterans Memorial at 2:17 in the afternoon. Amara knew the exact time because she had been watching the clock above the nurse's station the way she watched everything, not obsessively, not anxiously, but with the steady peripheral awareness of a person who understood that time was a variable like any other, and that variables had a way of determining outcomes when you stopped accounting for them. She had spent the last 3 hours doing her job. She had checked Raymond Okafor's chart and reviewed his medications and sat with him for 11 minutes while his daughter arrived and proceeded to be exactly as loud as he had predicted. She had cleared Daniel Park for transfer to a step-down room and made sure his sister had the attending's direct line. She had called the cardiac wing twice about Martinshoe and received updates that were progressively better and left her with a particular quiet satisfaction of someone who had held a situation together long enough for the situation to find its own footing. She had also wrapped her ribs properly in the staff bathroom between her second and third check-ins, this time with the kind of focused clinical attention she had not been able to give the first pass, and determined that she had one confirmed fracture on the left side and probable bruising on 2 adjacent ribs, and that the pain, while significant, was not going to limit her function in any way she was unwilling to manage. She was at the nurse's station writing a medication note when Briggs came through the main ER doors with a woman she had not met before but recognized immediately. Federal investigators had a particular quality that was distinct from law enforcement and distinct from the military and distinct from intelligence, though it shared elements with all three. It was something about the way they carried their authority, not as a uniform or a weapon or a clearance level, but as a kind of settled certainty that they were operating in the correct place at the correct time for reasons that were fully accounted for. Delgado had it in every line of her posture. She was in her mid-40s with the kind of face that had been striking once and had matured into something better than striking, something that communicated competence and patience in proportions that most people spend a career trying to balance. She wore a gray blazer, and she moved like someone who had been moving through difficult rooms for a long time and had made her peace with the difficulty. She found Amara's eyes before Briggs had a chance to make an introduction. "Ms. Mensah," she said. "Dr. Delgado," Amara said. Briggs looked between them. He had the expression of a man who was recalibrating again the amount of information he had been operating with versus the amount of information that had been in the room this entire time. "You two have spoken before," he said. It was not a question. "We have corresponded," Delgado said. "This is our first time in the same room." She looked at Amara steadily. "I'm glad you're in one piece." "I had a good morning," Amara said. The corner of Delgado's mouth moved. "I've been briefed. I would characterize it differently than that, but I understand your framing." She looked around the ER with the quick professional scan of someone reading a space. "Is there somewhere we can sit?" They used the small consultation room off the main corridor, the one with the round table and 4 chairs, and the framed print of a coastline on the wall that Amara had never looked at directly in 11 months of working here. Briggs came in and closed the door. The three of them sat down, and for a moment nobody spoke, which was fine with Amara because she was using the silence to finish a thought she had been working on for most of the afternoon. "You should know," she said before Delgado could begin, "that I understand what today was, all of it, not just the tactical situation, the larger shape of it." Delgado leaned back slightly, listening. "You needed Archer contained in a location where the threat could be managed," Amara said. "You needed someone in that location who could respond to a breach at a level your standard security detail couldn't account for, because your standard security detail was a known quantity to Webb's network, and a known quantity could be planned around. You needed someone who was not on any active federal roster, someone who looked like the furniture." She looked at Delgado. That's what the 3 sentences meant. You needed me to be the variable that Webb's intelligence hadn't accounted for. Delgado did not look away. "Yes," she said, "that's accurate. You put me in a hospital building with a federal witness and 6 armed men, and you didn't tell me the full operational picture. I gave you the information required to establish your position," Delgado said. "The full operational picture was need to know, and your role was designed to function without it. If you had known Archer was in the building before Webb made his move, your behavior in the ER might have changed in ways that read as foreknowledge. It needed to read as genuine reaction." "It was genuine reaction," Amara said. "I had no idea Archer was in this building until Webb asked Sandra about him by name." Delgado paused. Something shifted in her expression. "You didn't know Archer was at Veterans Memorial?" "I knew I had been placed here by your request," Amara said. "I did not know the specific asset I was positioned to protect. Your message said position, not assignment. I assumed it would become clear when it needed to be clear." The room was quiet for a moment. "You worked blind," Delgado said slowly. "I worked as a nurse," Amara said, "which is what I am. The rest came when the rest was needed." Delgado looked at her with something that had moved past the professional assessment into a territory that was more difficult to categorize. It was not admiration exactly, though it contained elements of it. It was closer to the look of someone who had built a plan around an assumption and was now confronting the fact that the plan had worked for reasons that were not entirely the reasons they had designed it to work for. The contact, Amara said. Briggs told me the name. I want to understand how that breach happened. Delgado straightened. The contact was a hospital billing administrator. She had access to patient intake records and staff scheduling through her administrative system. Webb's network had been running a low-level surveillance operation on 3 hospitals in this region for approximately 2 months, looking for the pattern of a protected admission. When Archer came in, the pattern matched, and they recruited the administrator through financial pressure. She had significant personal debt and a family situation that made her vulnerable. She was in that ER this morning, Amar said, standing against the wall with the rest of the staff, watching everything happen. Yes, Amara thought about that, about what it meant to stand in a room that you had helped arm against itself and watch the consequences move through the space around you. She did not feel sympathy for it exactly, but she felt the complexity of it, the human architecture of how someone arrived at a decision like that, the accumulated weight of circumstance and desperation that turned a billing administrator into an intelligence asset for violent men. What happens to her, Amar said. Federal charges, Delgado said. Conspiracy at minimum, potentially more depending on how the legal team assesses the direct link between her information and the harm to the patients. Martin Chu, Amar said. Among others, Delgado said. She let that sit. Then she said, the oversight hearing, 6 days. 6 days, Delgado confirmed. You need my testimony. We would like your testimony, Delgado said with the precision of someone who understood the difference. You are not compelled. Your operational record from Meridian is incomplete, and the parts that are complete are classified at a level that makes compelled testimony legally complicated. What we have is Archer's account, the documentation he pulled from the server and the financial records from Webb's network. That is sufficient to prosecute. But the Oversight Committee is looking at the larger question of how Meridian operated, who authorized it, and what protocols exist to prevent similar programs from running outside oversight in the future. Your account of what the program actually was from the inside, from the perspective of someone who was recruited and trained and deployed and then chose to walk away, that's not just evidence. It's the part of the story that makes the evidence mean something to people who weren't in those rooms. Amara looked at the framed coastline print that she had never looked at directly. She looked at it now. Blue water, gray rocks, the kind of light that belonged to early morning on a coast she did not recognize. When I left Meridian, she said the official reason in the paperwork was medical discharge. Injury sustained on deployment. That was true. It was also incomplete. I know, Delgado said. The incomplete part, Amara said, is that I left because I had begun to question the authorization structure of the operations I was running, not the individual missions. The framework. Who was actually directing us and whether the people directing us had the authority they claimed to have, and whether the outcomes we were producing were being accounted for by anyone above the operational level. That questioning, Delgado said, is exactly what the Oversight Committee needs to hear. If I testify, Amara said, my name enters the public record, not my designation, my name, Amara Mensah, nurse, former federal contractor. This hospital, this job, this version of my life, it stops being something I built quietly in my own time and becomes something that exists in the public record of a congressional proceeding. Yes, Delgado said. She did not soften it or qualify it. That's accurate. Amara was quiet for a moment. Briggs, who had been sitting with his hands folded and his eyes on the table for most of this conversation, said quietly, for what it's worth, what you did in this building today is already in a federal incident report with your name on it. That report goes to the same Oversight Committee. They're going to know who you are regardless. She looked at him. He was not wrong. I need time to think, she said. You have 6 days, Delgado said. I need tonight, Amara said. I'll give you an answer tomorrow. Delgado nodded. She reached into her jacket and placed a card on the table. Simple. Name, number, a federal seal. Call me when you're ready. Anytime. Amara picked up the card. She looked at it for a moment, and then she put it in the pocket of her scrubs next to the stethoscope she had been carrying since 7:48 that morning. She stood up. Briggs stood with her. Delgado remained seated. One more thing, Delgado said. Amara turned. The reason I sent you that message 8 months ago, Delgado said. The reason I chose you for this position above the other Meridian graduates I had files on, it wasn't entirely operational. Amara waited. You were the only one who left, Delgado said. Not because you were forced out, not because you were burned or compromised or determined to be a liability. You left because you decided to. You made a choice based on a moral assessment of the situation you were in, and then you did something I have never seen anyone from a program like Meridian do. You went to nursing school. You went back into the hardest possible version of the work, the version where you sit with people when they are at their most broken, and you hold the line between them and the worst possible outcomes, and you do it without any of the institutional authorization or tactical equipment or backup that you spent 8 years operating with. She paused. I didn't put you here because you were trained to handle threats. I put you here because you had already demonstrated that you knew what you were protecting and why it mattered. The room was very quiet. Amara stood with her hand on the door. Get some rest, Ms. Mensah, Delgado said. You've had a long morning. She went back to the ER. The afternoon shift was arriving. She could feel the change in the room, the incoming energy of people who had not spent the morning inside an armed hostage situation and were arriving into the aftermath of one reading the room, asking careful questions of the staff who remained. She moved through the transition with the muscle memory of 11 months, handing off charts, flagging open cases, communicating priorities in the compressed shorthand of shift change. Ray Delroy stopped her at the edge of the nurses' station. She had seen Ray around the hospital for months without learning much about him. He was a facilities maintenance supervisor, retired Marine, 61 years old, with a face that had been lived in hard and kept carefully, and he had always struck her as someone who observed more than he spoke. He had been in the ER that morning, not as a patient. He had been doing a routine check on the ventilation panel near the waiting room when Webb walked through the doors, and he had spent the next hour and 40 minutes sitting against the wall with the other non-medical staff, silent and watchful. He had not panicked. She had noted that at the time and filed it and not revisited it until now. Mensah, he said. Delroy, she said. He looked at her for a moment with the particular directness of someone who had decided not to waste either of their time with preamble. I was watching you this morning, he said, from the beginning, from the moment that man walked in. I know, she said. He raised an eyebrow. You were positioned against the east wall, she said. You didn't flinch when Webb fired the first time. You watched the exits in a specific sequence that told me you'd been trained to do it. And when Dayon's associate moved toward the medication cabinet, you shifted your weight forward approximately half a second before anyone else in the room reacted. You were reading the room the same way I was. Ray Delroy looked at her for a long moment. Then something in his face that had been held carefully for a long time released just slightly, just enough. Marine Raider, he said, 2 tours in Afghanistan, 1 in Iraq. Retired 12 years ago when my knees decided they were done before I was. He paused. You weren't just reading the room, Mensah. You were running it. I've worked with people who were trained at the highest level, and I've worked with people who thought they were. You were the real thing. She looked at him steadily. I'm a nurse, she said. You're a nurse, he agreed. And you're something else. Both of those things are true at the same time. He tilted his head slightly. I'm not asking for an explanation. I've been in enough rooms where people were more than they appeared to be to know that the asking is the wrong instinct. He extended his hand. I just wanted you to know that I saw you this morning. What you did for those people. The old man on the floor and the scared kid with the rifle and all the rest of them. I saw it. She took his hand and shook it. Thank you, she said, and she meant it without qualification. She finished her shift at 6:15. She sat in the break room for 8 minutes after she changed out of her scrubs, drinking water from a paper cup and feeling the day settle into her body the way long days did not, as exhaustion exactly, but as a kind of density, a heaviness that was not entirely unpleasant because it was the weight of things that had mattered. Sandra came in at 6:22 and poured herself coffee from the pot that had been burning since 3 in the afternoon and sat down across from her without being invited, which was new. Cardiac called, Sandra said. Martin's rhythm normalized around 4 o'clock. They're keeping him for observation, but his attending thinks he's going to be fine. Good, Amara said. Keisha Williams is out of sedation, Sandra said. Her husband got here around 3. He sat with her while she cried for about 40 minutes, and then she fell asleep, and he sat there holding her hand. Sandra wrapped both hands around her coffee cup. I have been doing this job for 22 years, she said. I have seen things that would stop most people's hearts. And today was different from all of those things in a way I'm going to be processing for a while. Amara nodded. I'm not going to ask you questions you don't want to answer, Sandra said. I want you to know that what you are or were or where you came from before this hospital, that's yours. But I am going to tell you something that you need to hear. Amara looked at her. You are the best nurse I have ever worked with, Sandra said. It was not a compliment delivered warmly. It was delivered the way Sandra delivered most important things, directly without softening, because softening would have diminished it. Not the most credentialed, not the most experienced, the best. Because you care about the actual human beings in those beds in a way that goes all the way through you, not just to the edge of your shift. And whatever else you are, whatever else happened in this building today, that is not separate from what you are. It is part of the same thing. Amara held Sandra's gaze. I'm going to need a few days, Amara said. There's a situation I have to address outside the hospital. Take what you need, Sandra said. I'll cover your schedule. Thank you. Sandra stood. Don't thank me. Just come back. She rode the bus home. She sat in the back near the window and watched the city move past in the early evening light, the streets filling with the particular energy of a Tuesday giving way to Tuesday night restaurants, opening people walking fast with somewhere to be, the ordinary, relentless motion of a city that did not know what had happened in a hospital on the north side that morning and was not required to know. That was how it worked. The ordinary world moved on its own schedule, and the things that happened inside crisis did not pause it. They just happened alongside it in the same city, in the same evening, under the same sky. She got off at her stop and walked the 4 blocks to her apartment and stood in the kitchen at the window and made coffee that was too strong and looked at the city coming into its nighttime version of itself. She took Delgado's card out of her pocket and set it on the counter. She thought about what Delgado had said, about leaving Meridian because she had decided to, because she had made a moral assessment and acted on it. She had never thought of it in those terms before. She had thought of it as quitting, as choosing the version of herself that could face the mirror in the mornings, of the kind that started at 4:30 and involved a ceiling and a radiator and coffee that nobody else would drink. She thought about Raymond Okafor telling her to do what she needed to do, before she had done it with the equanimity of a man who had learned not to mistake apparent calm for absence of capability. She thought about Martin Chu standing on his feet for 20 minutes with a gun to his head because he had decided that was how he was going to spend those 20 minutes. She thought about Trevor, who had been shaking against a wall for an hour and then stood up and told a man with a rifle to take his hands off someone else. She thought about Dion, who had come into that hospital with the wrong people and the wrong plan and had still managed at the last moment when it cost him something to set the rifle down. She thought about what it meant to be in a room when everything was wrong and to choose in real time what to do with what you had. She picked up the card. She did not call Delgado that night. She had said tomorrow, and she meant tomorrow, because tomorrow was when she would have processed enough of today to speak clearly about what came next. And speaking clearly was something she required of herself, even when it was not required of her by anyone else. But she knew, standing in her kitchen with the coffee and the card in the city outside the window, what the answer was going to be. She had known it, she suspected, since Delgado had said the thing that was not operationally necessary to say the thing she had said, because it was true and because truth had a way of demanding to be said aloud even when silence was more tactically convenient. You were the only one who left because you decided to. She had built this life on that decision. The nursing school, the clinic in Baltimore, the 11 months at Veterans Memorial, the 4:30 mornings and the 2 strong coffee and the bus rides and the patients who came in broken and left less broken and sometimes left the same and sometimes left not at all. She had built it deliberately, brick by brick, out of the conviction that the things she knew how to do could mean something different depending on how and why and for whom she did them. Today had not challenged that conviction. Today had confirmed it. She set the card on the counter and she went to bed, and she slept without negotiating with her past, which was not something she could say about most nights, and which told her as clearly as any intelligence report or operational assessment she had ever received that she had landed in the right place. The next morning she was awake at 4:30. The ceiling, the radiator, the coffee. She stood at the kitchen window and watched the city in the gray hours before sunrise. Then she picked up the card and she called Delgado, and then when Delgado answered, she said, "I'll testify." And the word that came after that was good. And then she said, "One condition," and Delgado said, "Name it." And she said, "I go back to my patients after. When the hearing is done and the testimony is on the record and whatever happens next happens, I go back to Veterans Memorial. I go back to my shift. That part of my life is not a variable." There was a pause on the other end, not a long one. "That's not a condition," Delgado said. "That's a statement of fact. Of course you go back." She ended the call, she finished her coffee, she got dressed, and she walked to the bus stop in the early morning, and she rode 40 minutes north, and she walked through the doors of Veterans Memorial Hospital, and she picked up the first chart of the day. There would be a congressional hearing, there would be testimony and record, and the long institutional process of accountability finding its shape. There would be conversations she had been deferring for 4 years that were now going to happen whether she was ready for them or not. There would be a version of her name in a public record that she had not put there and could not take back. All of that was true, and all of that was coming. But right now, there was a patient in Bay 4 who had been waiting 20 minutes for someone to explain what his test results meant in language he could actually use. And there was a woman in Bay 7 whose blood pressure was trending in a direction that required attention. And there was Raymond Okafor being discharged from the cardiac wing this morning with a diagnosis he needed help understanding and a daughter who was going to be loud about it. Amara Mensah clipped her badge to her chest, looped her stethoscope around her neck, and went to work. Not because she had no other options, not because someone had placed her in position, not because of what she had been or what she was being asked to become, because this was what she had chosen, and she had chosen it all the way through, and that made it hers in the way that only the things you have truly decided can ever be yours completely, without apology, without revision, without the need for anyone else's understanding to make it real. She was a nurse. She had always been more than that. And for the first time in a very long time, both of those things stood in the same room without one requiring the other to be smaller. That was enough. That was more than enough. That was everything.